Dr. Marlene. I'm the pharmacist here. How may I help you today?
Well, the doctor said you would talk to me about medication to help me cope with my chemotherapy.
Right, right. So, just so I have a good idea of what medications you're on and what general conditions you have, I'd just like to take a few minutes to go over your medical history. Is that okay with you? Perfect. So, may I get your name, please?
Shelley Peterson.
Shelley Peterson. Shelley. Do you have your Alberta Healthcare card with you today?
Not with me.
Not with you. Okay. We have you on the system.
Probably, yeah.
So, what allergies do you have? Any allergies to any medications that you
Not
know
that
of?
I know of.
Nothing that you know of yet. Okay. And what sort of medications do you take, like prescription medications to start with?
Cetirizine.
Cetirizine. Okay. And
Cetirizine.
what sort of allergy? Like what?
Oh, for
symptoms?
rhinitis. Oh,
rhinitis.
It's rhinitis.
Oh, okay. And is it seasonal or all year round?
No, it's seasonal.
Seasonal.
I don't always take it when I'm starting to feel.
Okay.
I'm
And
not having a
just
reaction.
once a day or kind of thing? Or
Once a day.
Once a day? Okay. And do you get it over the counter or is it prescription? It's prescription to 20 milligrams. Okay.
Or just 10 milligrams.
10 milligrams? Okay. Okay. Do you have to take any other antihistamines or does this kind of take care of your
That
symptoms?
takes care of them.
Okay. And what kind of symptoms? You get just a stuffy nose kind of thing?
Yeah, really.
Okay.
Kind of itchy sometimes.
Right. Okay. Okay. Well, that's good that this works for you. Have you been taking this for a while?
Well, I always usually have to take it in the summer.
Oh, okay. All right. Do you use any nasal sprays for this purpose? Nothing else. Okay. Do you take any other prescription medications other than this? No. Okay. And then the cancer drugs that you're on is the doxorubicin, cyclophosphamide, and the docetaxel
Well, I haven't started them
chemotherapy.
yet.
You haven't?
But I start chemotherapy next week.
Next week. Okay.
But I guess the doctor wanted me prepared
Just to
for
go
everything.
over it. Yeah. Yeah. Did they kind of go over the drugs to see the talk about expected side effects or expected therapeutic effects?
We talked about therapeutic effects
Okay.
of the medication that I was taking with the chemotherapy.
Right, right. And how long ago was your diagnosis?
Well, they found the lesion 3 months ago.
3 months ago? Okay.
And I was diagnosed shortly after that.
Oh, okay.
But I had a lumpectomy last month.
Last month? Okay. Is this your first diagnosis or have you previously had any breast cancer diagnosis?
First time.
First time, okay. And does anyone else in your family have this?
My grandmother did. She died of breast cancer.
Oh, okay. And did you kind of like, since she had it, you kind of know the whole, how it works or what?
Well, that's
kind of
why I've
issues
been
you might
doing
have?
early screenings.
Right. So you get your mammograms done pretty
Yeah, I started early for that reason.
That's perfect, yeah. Okay, so the main concerns with these medications, the chemotherapy, are general side effects, like the nausea and vomiting, which are very common because these drugs are known to induce a lot of nausea and vomiting. Now, how in general do you ever have issues with nausea and vomiting or with flu or anything like that?
Not usually. I usually have a very strong stomach.
Okay, that's good. You don't take any other medications for any other medical conditions? No. What about over-the-counter medications? Just not prescription medications? No? Like Tylenol or any herbal products off the shelves?
Multivitamins.
You take multivitamins?
Yeah.
Okay, like one a day kind of thing? Okay. Any other supplements, vitamins or anything like that?
No.
No? Okay.
Because I'm just worried because I'm worried about how sick I'm going to be because
Right.
I have 2 quite young children and
How old are they?
3 and 5.
3 and 5, okay.
So I just think I'm not going to be able to take care of them when I'm having all
Right.
this chemotherapy treatment if I'm having lots and lots of side effects.
Right, and I understand, like, patients do get used to it, but the beginning is, like, especially the first cycle might be a little bit hard to, you might feel fatigued and a little out of breath and kind of thing. You will have to, like, eventually you will get used to it, but the first I will definitely expect a little bit of fatigue and not being able to do a lot of the things that you normally do just during the first cycle kind of thing, because then you know and you can adjust around what's going to happen and we can control a lot of the symptoms.
Feels like it's going to be scary for them.
I will. It is a little it's a little hard to kind of work around the chemotherapy symptoms and stuff, but I'm sure like there are drugs out there that you can take. I see that you've been prescribed the ondansetron, which is a really good anti-nausant. Now there's one, two, and you're on the 3, and then the one that's sub-Q injection, which is after chemotherapy.
So what does that mean, sub-Q?
So it's just underneath your skin. It's an injection. You can't take a pill orally, so
Okay.
they will have to do it at the clinic. The other pills are all like oral, so you can take them on your own. Usually, what the regimens are like, you have to start with certain medications before you go for your chemo, just so you have that extra before the symptoms even start. You have a little bit of medication in your system to kind of combat that. And then once you go for your chemo, you get your chemotherapy, and then you would keep taking the medications after for a few days after your chemo. So that kind of in general takes control of the induced nausea and
Because it sounds like if
vomiting.
I'm on like 4 medications, that seems
Mhm.
like an awful lot of medications, and the doctor must be expecting that I'm going to have quite a big reaction to the chemotherapy.
It is these combination of drugs are well known to induce a lot of induce a lot of nausea and vomiting, but we do want to use good drugs to combat your cancer, right? Like we want to use the big guns. We don't want to stand back on that one. So definitely we're going to use a lot of different drugs just to prevent the side effects, just because we don't want to cut back on the cancer. So we want to use good drugs. So to deal with the side effects, we'll have to use a few other drugs. But like, what are you concerned about not being like doing your day-to-day things?
Mainly
or
just in
what sort
terms of because I'm on medical leave, that's fine.
Right.
It's more just not being there for my kids, because they're I think they're too little to really understand entirely what's going
Right,
on.
right, that is very true.
And I'm not going to look the same, and I'm
Right.
going to be behaving strangely, and
Right.
and it's a lot to ask them to understand.
It is, and do you have a partner, spouse that can take
My
care of
husband.
them as well? Your husband, okay. Yeah, I know the kids are really young, and it's kind of hard to explain to them also like what's going on, what's not going through, and I can understand how hard that can be. But that's just definitely a part of the whole treatment that you're gonna have to get a little used to. And usually after a few cycles of chemo, you do feel a little bit better. And definitely, if you have any questions or concerns with anything, you can contact one of our team members of your chemo. We're always here to help you. So, like I said, there's 4 drugs here for your nausea and vomiting for the chemotherapy. But I noticed that they haven't included the one drug, aprepitant, which is a newer drug, and which is known to work very well for that purpose. So what I'm going to do today is I contacted your doctor, and they were okay with me prescribing it to you, since I do have additional prescribing rights. So are you okay with me giving you a prescription for an additional drug?
If it's important to take, absolutely.
Right, and you're okay with doing that?
Yeah.
And you're okay with me doing that?
Oh, yeah.
Okay, perfect. So what I'll do is I'll give you a prescription for that. You can get it filled at your pharmacy. Have you already gotten these other medications,
Not
or
yet.
you still have to
No.
get them?
No, the doctor said I should talk to you first.
Right, right. I would imagine that for the first, once you get the chemo and with a lot of the nausea and vomiting, it might be hard for you to eat properly. A lot of the times plant diet will help. Eating as much as you can, because a lot of the times people don't even feel like they want to eat. They're not hungry at all. So make sure you remind yourself to eat whenever you get 3 times a day kind of thing, because you will not feel like actually eating. Okay, so that's really important so you don't lose your weakness, right? Let me just write a prescription for you before we forget. I have to look it up, the dosing. I'll just have to look up the dosing, because I'm not too sure about the dosing, so I'm just going to get back to you on that one. When do you start your chemo? Is that next week?
Tuesday.
you said? Next week, okay. I'd like to talk to you after your first round of chemo, just to see how things are going, how your nausea vomiting medications are working, if they're working or not.
When should I see you again?
You're coming here for your chemo, aren't you, on site? Okay. Can you come back the next day? Okay, well, let's meet then, and I'll get your prescription ready. Okay.
Okay, thank you.